This was a pre-approval safety study, and it actually did achieve statistical significance for what it was designed for, which was non-inferiority. In the test of superiority, I'm actually not at all surprised that it didn't achieve that. And the reason for that is because it's an event-limited trial. So the trial, including the treatment period, stops as soon as the minimum number of events were achieved. And for that reason, the duration of the trial is relatively short compared to many other trials in this field. So in that context, actually, the fact that we see a non-significant 21% reduction is sort of consistent, because the magnitude of that is very consistent with longer duration trials of much larger size that have been conducted previously. And despite that, some of the secondary endpoints showed statistical significance. For example, there was a significant reduction in death, both cardiovascular death and all-cause death. Now, I urge caution in interpreting those data because the numbers of events were small and because the median duration of follow-up is only about 16 months. But that's by design. Earlier, we've seen publications from the Pioneer program, both published earlier and some published at this meeting and presented at this meeting, which really have identified that the oral formulation at the 14 milligram dose in particular is actually very similar in its efficacy with glycemic control and body weight reductions to other injectable GLP-1 receptor agonists and other agents, including DPP-4 inhibitors. It's superior to them and similar to an SGLT2 inhibitor. So those data have now been published and available. So I'm not concerned that the oral once-daily formulation is in any way functionally distinct from the subcutaneous. And again, I think that was one of the questions is previously all of these agents have been given subcutaneously, and would the side effect of nausea, other GI symptoms be similar when the drug is given orally? And in fact, we see that it is. It's very similar. The medication continues to have those side effects, predominantly mild, and limited in duration, particularly when the dose is titrated upwards, but remarkably well tolerated ultimately, because about over 80% of the patients in Pioneer 6 were on the full dose of the study drug. So the discontinue rates for the oral agent were clearly higher than placebo, but not that distinct from the discontinuation of injectable. In the clinic, when we're treating our patients with diabetes, for me as a cardiologist, there are really two considerations. Number one, am I treating their diabetes with an agent that reduces cardiovascular event rates? That's number one and the higher priority. But then number two is, will my patient be compliant? Will they accept the recommendation? And for some patients, if they're already on insulin, which is administered as a subcutaneous injection, they may be comfortable with the injectable form of a GLP-1 receptor agonist or other injectable medications. But for those patients who are not yet on an injectable medication, or those that might be on insulin but don't want to take a second injection, I think now having an oral formulation of a GLP-1 receptor agonist is a really important development. And once it's available, I think you're going to see that barrier of convincing the patient to adhere to an injectable will be lessened.